Welcome, Dr. Stout, to Hope Stream. This is a conversation that is so important. I think I couldn't do enough episodes on marijuana and the impact that it's having. And you truly are an industry expert in this area. So I'm thrilled to have you here for real information, not just anecdotal information. So thank you so much for making the time.
I'm happy to be here.
Great. Well, we've talked about marijuana on the podcast several times with folks, but I think there's always new information that we're getting that is important for parents to understand. And as parents, I forget I've been doing this for 3 years. And so as parents kind of age into the podcast, sadly, they do, they might not have heard episode, 5 or whatever it was where I talked about this. So maybe you could just give us a quick kind of state of the industry, if you will, of what you're seeing as far as usage, especially with adolescents, because I know that's an area that you have a ton of knowledge in, and that's what I am concerned about is the impact on the adolescent brain. But maybe just give us from a 50,000-foot view, what is going on in the marijuana industry?
Yeah, well, it's very sad what's going on because, I've been working in this field for the last 33 years. So I'm an addiction psychiatrist and I ran a treatment program at the state hospital in Colorado for the last 20 years. And it was a really excellent program. It's, defunct because of money issues or something, sadly. They, No, I was treating people who have failed everything else. So people who had been through multiple treatment programs. And it was a dual diagnosis program, one with people who had mental health issues and substance abuse issues. And I started seeing more and more problems of marijuana. In Colorado, we legalized medical back in 2000. And I thought it was stupid to vote for a medicine. And I didn't vote for it. But I wasn't that worried about it because back in 2000, marijuana was starting to get stronger, but it was a problem. We weren't seeing a serious problem with it. And the highest potency back in 2000 was 5% in the plant. And there were no concentrates. And so I really think people voted for it because they thought this was compassionate care for those poor people that were having very serious medical problems. And then the industry, what happened was basically really started in 2009 when the Obama administration put out the Ogden memorandum, which basically said they would not prosecute anybody in the state medical marijuana if they were following the law. And so in our state, in Colorado, in 2009, we had 5,000 people on the medical marijuana registry. By 2011, there were 119,000. So people either got really ill all of a sudden, or they were flocking to get their medical cards so that they could, have legal marijuana. And around 2010 is when the concentrates hit the market. So we started getting stronger and stronger potency things to the point now, until then we legalized recreational in 2012. The stores opened in 2014. And then we had incredible numbers of people that were getting marijuana. And the potency now, the average in the plant is around 20%. But we had plants with much higher potency. And then the really concerning thing are the concentrates, because concentrates that go all the way up to 99.9% pure THC. And these are still being advertised and marketed as medicine, and they are available in the medical market, which is crazy because there's no research on them at all supporting their use in any kind of medical condition. And if you look at the research supporting marijuana for any medical condition, it's done with all less than 10% THC. And the problems are showing up with THC higher than 10%. So 10% and higher is where we start seeing problems. And 10% lower than 10%, we don't see that many problems. And so what has happened in Colorado is the kids, I think, because their parents are using, their parents think it's safe, they think it's safe, they think it's medicine. So they're vaping oil, they're dabbing, wax, shatter. These things that are very high potency and very, very dangerous for the developing brain. And that goes all the way up to 25.
Yeah. And when you say the dabbing, the concentrates and the shatter and all of that, that is where you're talking the concentrates that were introduced in 2010 that can be up to 99% pure THC, right? That is so frightening.
And so we're seeing so many problems with adolescents in Colorado that we were able to pass a bill in 21. It was called House Bill 21-1317, which we didn't get everything we wanted for sure, but we were able to get some things to happen, like warnings, like there's a handout that if somebody goes to a dispensary to purchase a concentrate, they have this handout that says all the problems are related to using these products, like addiction, psychosis, cannabis hyperemesis syndrome. And the one thing we couldn't get on there, because the industry fought it, was suicide. However, there is so much research out there now demonstrating this high correlation between cannabis use and suicidal ideation and attempts. And in fact, in Colorado, it's the number one drug found in toxicology of teens who die by suicide. And I prescribe a lot of psychiatric medications that have black box warnings about suicide. I mean, pretty much everything that impacts the brain like that very strongly can have that. Anyway, so the other thing that we were able to get was a significantly decreased amount that could be purchased. Because prior to this bill, 18 to 20-year-olds could get medical marijuana cards without any parental consent or knowledge. And they could purchase 40 grams a day. And it's like insane. And everybody could purchase 40 grams a day, people of the recreationals, adults, medical. And so in this bill, we got it reduced to where 18 to 20-year-olds can only purchase 2 grams a day, and adults can purchase 8 grams a day. That's still a whopping amount of marijuana. And because if you look at, we do have medication that is FDA approved, that is basically based on THC. So there's a drug called marinol or dronabinol, which has been used for some time for people with severe cancer. They're having debilitating illnesses where they can't eat, and so it's to help with them increasing their appetite. And the maximum dose recommended by the FDA is 20 milligrams a day, so 10 milligrams BID. Now, an 18-year-old with the medical marijuana card in Colorado can purchase 2 grams a day. So that's 2,000 milligrams. You look at that, like if it's an 80% THC, that's 1,600 milligrams that they can purchase every day compared to the 20 grams that you recommended for medicine. And that's
Right.
It was insane. There was actually the industry, we tried to introduce a bill last week to revoke what we got out of that because they wanted to go back to be able to purchase 40 grams. And luckily, they didn't have enough votes to even bring it to the first committee. It was killed. So that was good.
I mean, from a medical standpoint, how could you ever justify that? It just makes no sense.
Well, yeah, and that's the other thing that the bill was supposed to do. I mean, it really spelled out what the doctors who are recommending marijuana were supposed to do. So instead of the bud tender at the dispensary recommending what people should take, the doctor was supposed to say, okay, this is the product you should use, the potency you should use, the amount, the frequency, the route. It's not happening. because they didn't assign any entity to monitor that and monitor the doctors who are doing that. And so I know several people, because I've been collecting these data, that are getting medical marijuana cards, and they've got bogus things. I mean, they don't have a medical problem that fits the criteria, and the doctors haven't spent any time with them. They haven't looked, you can do this online. You can get a medical marijuana card within like 60 seconds.
Right, right.
It's crazy. And just the fact that young people could do this is why we had such a big problem, because when they could get 40 a day, and I think it's happening now because nobody, I think, actually uses 2 grams a day. They, would sell to their friends. And so it became the way it got into the black market or the gray market. So more and more kids were getting it from people that had a card. And, I think what's happening in many states. And it's just, I think this is an experiment that we're going to really regret, mainly because of how it affects the developing brain.
Right. Well, I think we're, at least from the parents' point of view, we are deeply regretting it. And I think what you've said about diversion is really important, because a lot of parents who are kind of new to this discovery that their kids are using so much is, well, where would they get it? Well, where would they get it? Right? My kid's 14, my kid's 15. Where would they get it? And I think often there's a perception, they think of a drug dealer and they think of some creepy guy, in an alley somewhere. And it's like, oh no, this is the kid from the soccer team who, has this card and got more than they're selling it. So I think it's just a completely different landscape than parents are thinking in their brain of where their kids are getting this and the potency. So just to clear this up, because there's all this, well, marijuana can't be addictive because it's a natural plant. I am going to guess that you would say it is very addictive. And what I heard you say was that where you're seeing the problems is in the over 10% potency, but maybe you can talk to us about potency, addiction, sort of where that connection is, and is it more addictive for adolescents than adults?
Yeah.
All of that, just clear it up for us.
Yes. So, when I first got into this business back in 1990, we didn't even think it was addicting. It was, it was in the class of hallucinogens because we knew it caused hallucinations, and hallucinogens don't have a withdrawal syndrome. So that's why it was in that class. And the research is showing that when it was less than 5%, people did have problems, but it might have been more psychologically addicting. It wasn't a thing. So they did this big study that it's called a NISCAR survey, where thousands of people are surveyed and they get all this information. And so back in 2003, 4, 5, they really found out that about 8.9% of people who use marijuana would eventually then have a problem with addiction. And so that was considered the lowest addictive drug because it was less than 10%. However, then they did that survey again in 2012, 13, something like that. And that was still not as potent as we have today. And they found that 30% that used it would become addicted. And so this is all ages. But they found that, if you started using as an adolescent, then you're much higher risk of addiction. And I think it's only going to get worse because, in my experience treating people in an inpatient setting, I have worked very hard to make programs tobacco-free because I figure to have the best outcomes, it's best to quit everything at once. And if you're in an inpatient setting, that's the best place to do that. So I try and get programs to go tobacco-free because nicotine has always been the most addictive drug we have. And that's the one that people say is the hardest to quit. But now with these people doing this high potency stuff, I am finding the same thing, that is the hardest thing to quit. And so I think it's just, in this study that they did, they said with tobacco, almost 62% of the people who ever use tobacco become addicted to it. So that does have the highest addiction. But I think if we do this again with this high potency now, that it's going to be similar. And so, it's extremely addicting, which means it has a very severe withdrawal syndrome. And depends on, the potency people are using, how often they're using it, how bad the withdrawal syndrome is. But it has a very short half-life. And so what I was seeing in my program was that people were in withdrawal immediately, like within the first day or so. And people are showing that they're developing this addiction faster than any other addiction. And that really kind of scary. They did this study looking at, this was in Michigan, where they had people who were getting a medical marijuana card. So one group, they said, okay, go ahead and use the card immediately. And then the other group had to wait 12 weeks, so they couldn't use their card. And then they followed them to see, how much they were using and what developed cannabis use disorder or addiction to cannabis. And they found that the people who got the card immediately very rapidly developed cannabis use disorder. Within 12 weeks, they developed cannabis use disorder, which is very scary. And so people need to know that, because this is why people develop things like cannabis hyperemesis syndrome. Most people that just use cannabis occasionally are never going to have that problem. It's a very rare problem for most people. But what we're finding for the people that are using high potency and regularly, it's a very common problem. And so like young people I work with who after I finally convinced them that that's what their problem is, because that's the biggest problem. People cannot believe that cannabis is causing the symptoms. But these people have severe abdominal pain, severe nausea, cyclical vomiting that they cannot control. And we don't have meds that help with that very well. And anyway, once I finally convinced them, well, and they come back to me and say, well, yeah, I guess you're right. This is what's causing my problems. I'll say, well, then you need to quit. And they say, yes, I know. I need to quit. And then they can't. And that's another concerning thing, because what I'm finding is the only way these people are being able to quit are being in an inpatient setting, in a controlled setting when they're away from it.
Right.
And most insurance doesn't pay for cannabis use disorder.
Yeah. Wow. Okay, so I need to rewind. There's so much in there. First of all, you mentioned cannabis hyperemesis syndrome, and some of the symptoms that you mentioned, like the vomiting and all that. Could you, because I think what I'm hearing from the parents that I work with, I think they're seeing this, but they don't know what it is. So could you just tap on that really quickly, like what it is, what they might be seeing in their kids or what their kids might be experiencing, and then what should they do?
Yeah, no, this is something that the parents really need to be aware of. And sometimes they have to educate the doctors, because there's few doctors still that are really recognizing this. But it's, somebody who just feels nausea a lot, like they have periodic bouts of, they get really sick to their stomach and they start vomiting. And once they start vomiting, they can't seem to stop. And one of the things that has been found to help for some people is hot baths or hot showers. So if they're doing that and then they feel some relief, that's a really good clue that that's what's causing that. And, there's this really great Facebook support group that I give to everybody. It's called Recovery from Cannabinoid Hyperemesis Syndrome. There's actually several groups on Facebook, but it is wonderful in terms of helping people who have this problem, because they're supporting each other.
Okay.
And just I've worked with so many people that have been in and out of the emergency room with nobody noticing it because they're not asking the questions and people aren't
Okay.
providing it. And this is something else that needs to change in medicine because most places, you're mandated to ask, do you use alcohol, drugs, or tobacco? And if you ask those questions, people will say no, they're using cannabis because they don't consider it a drug. And
Even though
so
they had
you
to get
have
a medical card to get it.
yeah, you have to ask specifically about cannabis. Yeah.
Right, right. Okay, good to know. So then if they're seeing this in their young person, is it an ER visit? Like, is that the best thing to do?
Yeah. Well, yeah. And because what happens is, even though it is true that marijuana doesn't kill you outright, like people do not die from an overdose of marijuana. They can have miserable problems from an overdose. They don't die. However, with this cannabinoid hyperemesis syndrome, people are dying. And so this is a serious problem. And it is because if you vomit enough to deplete all of your electrolytes, that puts you at very high risk of dying. And you can kill your kidney doing that. And so if somebody, their kidney totally dies, or they have, their heart is losing all the electrolytes. So people are dying from this.
And be young people. This
So
is
often what has to happen, people need to be in the emergency room and get hydrated. So they get IV hydration and they're given medication to try and stop the nausea, vomiting. But the normal things that we use, like ondansetron or Zofran, don't work. And so people are having to get intravenous haloperidol. I mean, that's a very potent antipsychotic, but it does help with nausea and vomiting.
that's just so distressing to hear. And I'm glad that you mentioned that it may have to be a question to the doctor. Could this be DHS? Because they might not know. Probably in a state like Colorado or Washington or some of these states where we've had legalization longer, they may be seeing it more, I would think. But especially if you're in a state where it is not yet legal and you're seeing this, I would imagine there's a good chance that the doctors are not necessarily as aware.
Right. Right. And you're absolutely right about that. We're much more attuned to it in Colorado, but I had an 82-year-old gentleman who no one knew he was using marijuana, and he had had so many visits to the emergency room unrecognized and had 10 CAT scans of his abdomen. That's like awful. Until some very astute ER physician finally asked the right questions.
You mentioned psychosis. Well, you mentioned the medication and that it was an antipsychotic. I know that is another thing that parents are seeing is they're freaking out because their kids are having these psychotic breaks. They don't understand it. They don't know what to do. And from what I understand, that truly is happening from these high potency marijuana products. So maybe you could just talk about that. And then what do we know about the psychosis from this? Is it temporary or is it something that's going to be ongoing in their life?
Yeah. Okay. This psychosis issue is probably the worst. Well, also suicide. Those are the two worst forms of this. And the landmark study that it was out of the United Kingdom was back in 2015. That was the first one to kind of really point out that it was the high potency causing the problem. What they did was they did this evaluation of multiple people who were having their first episode of psychosis. And these were all ages, actually. And they found that if they were using the stuff that was 15% or higher, they had a 3 times increased risk of psychosis. If they were using it daily, there was a 5 times increased risk. And if they were using the stuff that was 5% or less, there was no associated risk of psychosis. And I think that's why we haven't seen that until now. Because as I said, when we first did medical marijuana in Colorado, the potency was 5%. And so I think that's why it wasn't really not noticed. But now with the high potency, we're seeing significantly increased risk. And all drugs, addictive drugs, have the potential of causing psychosis. I have even seen nicotine cause psychosis in a young person. But there was a study out of Denmark looking at all the drugs that can cause psychosis and looking at then did they convert to either schizophrenia or bipolar disorder. Because, most people who have a drug-induced psychosis and they stop using the drug, the psychosis resolves, it goes away. But you have this risk of converting to long-standing schizophrenia or bipolar disorder. And they found that the drug that had the highest conversion rate of all of them was cannabis. Almost 50% who used cannabis and developed psychotic symptoms converted to schizophrenia.
Wow.
And of course, the younger somebody's using, the higher the risk is for developing the psychotic symptoms. And there was another study just looking at people who use cannabis and ending up in emergency rooms, finding that 1 in 200 people have the risk of showing up in an emergency room with psychotic symptoms.
That's
So it really is a problem. And then once they have it, like I've worked with several young people who it took more than one antipsychotic to stabilize them. In fact, I was working with one young man who was 20, who it took 3 antipsychotics plus 2 months in an inpatient setting before his psychosis stabilized. And then, of course, he gets out and he wants the medication because the medication has awful side effects. And so I worked with him to do that, and he was able to get off the meds, and he was fine. And I warned him, do not go back to this because, this may be, the fact that this is not happening to you again. But if you go back to using, it could happen again. Well, sure enough, a month later, his parents bring him back, and he was back to being psychotic. And I said, what are you doing? And he told me he was dabbing again. And I really think that caused him to become permanently impaired. Very sad.
It's so sad. And it's just one of those things that it's one of the messages that needs to get through more to kids. Because I do think they can understand that. I think, oh, it's bad for your brain. Okay, whatever, right? If you don't have their prefrontal cortex developed anyway, well, maybe that's not. Maybe that message isn't hitting. But I do think some of these, because that just sounds really scary to think about schizophrenia or bipolar. And here's where I'm going in my non-medical brain. So I need your input on this is a lot of the times the reason these kids are using the products in the first place is because they are sort of self-medicating ADD, or maybe it is bipolar or one of these other conditions that's really difficult for them. So they find THC and it's like, oh, this works really well. So what I'm wondering is if you have like a baseline mental health problem, which is very likely, and then you start adding on these high potency products, which could lead to then the psychosis or something worse. How do you start to untangle, like, what's the original cause versus what's the, impact of the medication? That just sounds like a medical mystery to me. And especially for a parent observing this, like, how do you ever start to understand what's driving the bus?
Yeah. To me, the problem has come from people saying that this is medicine, because people self-medicate, but what they find is it doesn't help. I mean, it's a temporary thing. For a great example is post-traumatic stress disorder. there is no research that has been done that supports the use of it. All of the research has shown that it makes PTSD worse. But the reason people like it is because, yes, it initially works. Like when people are using marijuana to sleep, yes, it initially works. Then it starts affecting your sleep architecture, where then it doesn't help you anymore. Post-traumatic stress disorder, when you're under the influence of it, you don't have the intrusive thoughts, you don't have the flashbacks, you're numb. But the minute it wears off, they are right back. And so in order to keep the symptoms at bay, you have to use every day, all day long sometimes. And then it sets you up for all the other problems. So the same thing with people start using it for anxiety. Initially, it seems to help, but then ultimately it makes the anxiety worse. And this is really true of all addictive drugs if they're used addictively. And if you use higher potency products, I mean, we know that about all the drugs. And and so that's been the biggest problem is people have been led to believe that it is safe and a medicine. And so they're doing that. And so it's really hard to untangle that. And the other problem is if somebody has a psychiatric illness and they're on a medication, marijuana can actually make the medication not work because it interferes with the metabolism of the medication. And so that's what I was seeing a lot when I was working at an FQHC as a consultant psychiatrist, because they had primary care doctors who would make the diagnoses and prescribe medication. They had behavioral health people who were doing therapy, and they would refer them to me when nothing was working. And Spencer would come see me and I'd say, why am I seeing you? Well, you need to give me the right medication because this medication is not working. And so then I'd get the history from them and find out they're vaping 60% hash oil or something. And I said, this is why your medication is not working. And you really need to stop using the marijuana. Well, no, that's my medicine. I mean, it's just, wow. And so to me, the goal is we've got to get to people before they start using. Because if anything, the way these drugs work in the brain, and this is true of all of them, but especially THC and even nicotine does this, that when you're using chronically, it can shrink your hippocampus. And the hippocampus is where you put all your new memory and learning. So it can make it very difficult to learn new things when you're actively using. And this is why I advocate for tobacco-free treatment, because you're in treatment and if you're smoking the whole time, it's really hard to put any of that new information into your long-term memory bank because of the effect of the drug on your brain. And so I just know that when I'm talking to somebody who's actively using, they can't really hear me. I mean, they hear what I'm saying, but it isn't getting processed in their brain because all they are remembering is the good stuff, the good stuff. This is why people don't learn from their consequences. You would think if somebody has a psychotic episode, they would never, ever do it again. But because they haven't done anything to change their thinking, that old stuff was just wired in there. It's hardwired in there. And that's why somebody can sit in jail for months at a time, not using anything. If they haven't done anything during that period of time to change their thinking and actually get some treatment, this is why I think treatment should be available in jail. They leave, and even if they've sat there saying to themselves, I'm never doing this again, never ever, because I'm not coming back to jail. The minute they get out, the very first thing they do is buy cigarettes. And then, then they see their dealer and they make a deal. They make a buy because they haven't done anything to change the way they think. And that's what treatment is about. Treatment is about changing, putting in new wiring in your brain. Because 100 billion neurons, you don't use all of them. And you need to wire new neurons, and that's what has to happen.
So the short-term memory that you were talking about when somebody is using, I'm just wondering what some of those, specifically the adolescent brain, what some of those impacts are that parents might be seeing as an indicator. Because kids are really good, obviously, at hiding this, right? They can vape it and there's no smell. Parents don't know what's going on. And then I also want to ask you about edibles, but what are some of the things that a parent might see? Maybe they suspect, I don't know, maybe my kid's doing a little bit of weed, but are there things that they could watch for that would indicate that maybe there is a problem? When you mentioned short-term memory, that just stood out to me because I imagine there's a pretty big impact on the school work if you are talking about, an adolescent who's still in school. But what are some of the things that they could look for?
Well, a lot of it is not doing as well in school as they used to do. Um, because, you know, one of the things is and that is why kids need to sleep at night too. You have to go to sleep at night to incorporate all the stuff that you've gone through during the day so it gets into your long-term memory bank. But when you're actively using substances, it can actually affect your sleep architecture. So in order to learn new information, you have to go through all the stages of sleep. And that includes 3-4 sleep, which is slow wave sleep, before REM sleep. And you have to go through all these. However, all these substances of abuse can significantly diminish 3-4 sleep, which then makes it difficult to get that new memory and learning incorporated into your brain. And so that's a big one, is just, kids that, used to be doing really well, getting A's and B's, and now all of a sudden they're getting C's, even though it seems like they're doing their work and they're trying to apply themselves. That is a big one. Another one is impulse control problems, because it really does affect the frontal lobe. This place where, you're supposed to be making all your judgments. It's not fully online yet as an adolescent, so it's not working very well. But when you put a substance in there, like marijuana, it really isn't working at all. And
Right.
so kids have, poor judgment, impulse control problems. And then another thing I would really pay attention to is if they seem more irritable and more angry and aggressive, because that's withdrawal. And so withdrawal, if somebody's using pretty regularly, withdrawal is going to be increased anxiety, increased irritability, and really problems eating, problems sleeping, because marijuana helps with all those things, right? And so when kids are not eating as well, they're not sleeping as well, those can all be signs that something's going on.
Right. And I had a question about form factor, I guess you could call it. Is like if a kid says, "Oh, Dad, I'm just doing gummies, right? I'm not smoking it. It's not going into my lungs. I'm just doing gummies." Like, is that better? Something else? Because I think we get a lot of that rationalization.
Yeah. No, in fact, it's worse in the fact that, when you're smoking is not good for you, period.
Right.
And vaping's not good for you. They're not good for your lungs. However, you only get about 25% of the dose smoking. If you don't eat something, 100% of the dose. And so it's much more powerful. And so it's like 5 times as strong.
Oh,
And so, if people are limiting themselves to one gummy, like a 5 milligram THC dose, they don't. That's what's the such insane thing about the edibles. I really don't like the edibles, mainly because they're packaged to look just like other stuff,
candy.
Doritos or whatever, and that should be illegal. I mean, that should totally change. But we have, in Colorado, we were able to get a limit on recreational marijuana so that each piece is no more than 10 milligrams. That each piece that's 10 milligrams. And a package can have no more than 100 milligrams. That is a lot of THC, but that's like, the whole cookie or something. In the medical market, you can actually get a cookie with 1,000 milligrams of it. So one cookie. And when they sell these things to naive people, the bud tenders tell people, well, you only should eat a sixth of a cookie. Who eats a sixth of a cookie? And that's how, we had our first death in Colorado, was this young man who was an exchange student. I think he was from Nigeria, and he was in a college in Wyoming. And he and his girlfriend came to Denver, and he was not old enough to purchase anything, but she was. She purchased some cookies, and they took him back to a hotel, and they were told to eat a sixth of a cookie. And apparently he'd started by doing that, and then he ended up eating the whole cookie. And then he quickly became completely psychotic and started mouthing things about religion, and then he jumped off of the balcony in a high-story hotel and died. Because, he was out of his mind. And that was just from one cookie.
Right.
And somebody who's, naive to all this.
Yeah, and what I hear is that because the edibles take longer because they have to go through everything in your stomach, right? So they take longer. So especially a young person who's a new user will take one and wait 15 minutes and go, I don't feel anything. Take another one. Still not feeling anything, because it could take up to an hour to really kick in. So by then, if you've taken 4 or 5 10-milligram gummies or cookies or whatever it is, you're going to be in a world of hurt.
Right. Exactly. I agree. And
then
here with the young children, it's incredibly expanding. And what's so interesting is to look at data coming out of Canada, where they had this kind of biphasic approach to legalizing. So they didn't legalize recreational until 2018, but then they had a first phase and then a second phase. And in the first phase, the edibles were restricted. In the second phase, in most of the provinces, it was expanded so that edibles were available, but in Quebec, they were not available. And they show there was like an 800% increase in kids showing up in the emergency room, little kids, less than 9 years old, eating these things because they find them out somewhere. And in Quebec, they did not have that increase because they didn't have these edibles. And this happened in the provinces in Canada, even when they had even more restrict than we do, because their whole package is 10 milligrams. Our package is 100. And they have, child-proof packages and still, because they look just like it. If you have a gummy outside of a package, it looks just like any other gummy.
Yeah. That's horrifying. And it's interesting that there was that kind of like controlled study just because Quebec didn't have that they could see so clearly that the impact of having that. Wow. I'm wondering if a young person has gotten into this a little over their head and they're like, oh my gosh, I'm having all these horrible, side effects. I can't sleep. I can't eat. I'm, feeling like I may have some of these psychotic breaks. You had mentioned earlier that sometimes the only way to really get off of them is in an inpatient treatment setting. Is there anything that they could do at home to start? Like, is this something that you can taper down, or is this really like you got to just go 100% cold turkey?
Well, a lot of people, if you tried what I would call as harm reduction, and I've encouraged many people to do that. One of the problems is, harm reduction approach should be, well, let's get less and less potent products. Go get the stuff that's less than 10%. It doesn't exist. That's a big part of the problem. But if it does, then that's why you try and encourage people to smoke the less potent stuff and then slowly try and wean them off of that. I haven't been able to really find that stuff. I've been there is nothing like MIT like we had for opiates. There are companies that are working on that right now, trying to come up with something, because some people have been using the prescription THC drugs that we have to kind of help people. I don't know. That's very off label, and I don't know if it's helping or not. Uh, but then there is a thing called N-acetylcysteine, which is an herbal preparation, kind of. I mean, it's available in health food stores, so it's over the counter. And there is some research on that people have been able to use that to help people get off of marijuana and other drugs, actually. And normally, I think what I've heard is that you have to take like 1,200 milligrams twice a day, but that's available in health food store. And then the other thing I use that I find helpful is an ear acupuncture protocol that I train people to do. Um, it's a standardized protocol, so it's not really acupuncture per se. And in Colorado, we've been able to get the law changed to where pretty much anybody can learn to do this and help people with it. So I've been training people like peer coaches to use this to help people. It was originally developed back in the 70s to help detox people off of opiates. And it really does help with that. But we found that it helps for a lot of other things. And so I started using it mostly to help people quit smoking because my program was tobacco free. And it really did help keep people in treatment when they were like, couldn't stand the fact they couldn't smoke. If they got a treatment, they were much more likely to stay longer. And so the more treatments they got, the longer they stay. And so I've started finding that was helpful with the cannabis as well. I mean, it's not a standalone treatment. You can't put needles in people's ears and they change their behavior, but it is very helpful for people who are really trying to quit. And I also found that it was helpful for people with the cannabinoid hyperemesis syndrome symptoms. So,
Interesting.
so that's something to think about. People need to find an acupuncturist or somebody who has been trained in NADA or POCA. So NADA is an organization called the National Acupuncture Detoxification Association, and POCA is People's Organization of Community Acupuncture. And so people that work with or been trained by those organizations know this protocol and can help people with it.
That's fascinating. So is it something where like you would go get it while you're potentially in an outpatient program or?
Right.
Okay.
Well, I've been trying to use it everywhere. Like in Colorado, since we've got this law passed, we use it everywhere. And the place I had found it most powerful was in a harm reduction center, actually. So the woman who ran the needle exchange got trained, and then I went to supervise her because you have to do supervised treatments after you take the training. And when I went there was just one man in the room, and he was kind of your prototypical heroin addict that people think of. I mean, he was an old gentleman. He looked homeless. He didn't look very clean. He had no teeth. And he was sitting there with needles in his ears. And so they were trying to encourage all these other young people that were coming in for their needle exchange to go get a treatment. And so these young ladies would look in there and go, "Oh, you had needles in your ears. That's so gross." And then he said, "Oh, no, you got to come in here. I came here last week and I have never slept better in my entire life." And so
Wow.
next week when I went, the room was full of people getting treatment. And that's where I saw the magic. The magic was they had these peer counselors that were volunteering at the harm reduction center. And somebody would be sitting there with needles in their ears and say, "I just want to get off this stuff." And so somebody would say, "Well, I did methadone and this is how I did it. And this is where you go." Somebody else said, "Well, I did buprenorphine and this is how I did it. And this is where you go." And the other person said, "Well, I went to treatment and this is where you can get treatment." And that was like amazing. So it was
That's
like people
amazing.
starting the process of talking about it, because it really does help calm people down, and it helps with cravings. It helps with anxiety. And the biggest one is it helps us sleep.
That is amazing. I'd never heard of that before. So I'm going to put in the show notes, I will put links to the two organizations that you talked about. And do they have like a provider directory? Like, could you find, let's say you're in New
Yes,
Mexico,
yes,
like, could you
yes.
search and find?
Right. Yes.
Okay,
Yes.
perfect. That's amazing. I love that. I love finding new resources because at this point, I think we need everything that we can get, right? Amazing. Is there any, I think we've talked about some of, um, the difficulties in getting this messaging out, but are there other or any myths that you think are out there other than the fact that it's medicinal? Any myths that you think should be cleared up about THC, specifically when you're thinking about a young person? So, somebody who's maybe under 25, that we should get out to parents.
Well, the biggest ones are, the industry still says it's not addicting. And, I have a picture of the New York Times front page, I think it's 1995, with the all the tobacco executives standing in front of Congress with their right hand raised, swearing that nicotine is not addicting.
Yeah.
Yeah. Okay. And so the message is it is a very addicting. And in fact, it's probably as addicting as nicotine. So that's a problem. And then the other message is it really will affect your IQ. I mean, and if you use it regularly, you have a significant risk of losing IQ points. This one study out of New Zealand, I think it was New Zealand, followed these people, and they're continuing to follow people. So they picked these people up, over 1,000 people at the age of 13, where they did an IQ test before they ever had had marijuana. And then they followed them to 38 and did another IQ test. And they found that the people that never used marijuana had a stable IQ over that period of time. But those who used it regularly dropped 8 points in their IQ. And, if you're Mensa, that's probably not a big deal. But if you're at the average bell curve, so average IQ is 100, and you drop 8 points, you're in the significantly impaired rank. And so that group has continued to follow these people, and they just recently published the results at 45. And that's kind of fascinating because what they're showing is the drop in IQ is worse for marijuana than it is for alcohol or for tobacco.
Wow.
Two things that we know affect your, IQ. So marijuana is
Right.
worse.
Right. That's
And I
terrifying.
just have this big concern that we're going to have a whole generation of stupid people. Very sad.
Right. It's very sad. It's very sad. And I wonder, is there any messaging that you have seen or heard that really cuts through to a young person? Because obviously you're dealing with a brain that's not fully formed. Then you layer onto that brain. I just wonder how, because I think as adults, I hear this and I'm just horrified, and I think most adults are. But how do we get this message to the kids? Like, is there anything that you've seen that has been impactful?
Not yet. I actually just saw this thing, just saw it from NIDA. NIDA just put out a very short little video with the brain looking like a machine and how marijuana affects the machine. That was kind of cute. I like that. And I just, when I
Let's set
think
up.
of it speaks to any young people.
Right. Yeah.
Because,
Well,
the
that's good.
fried egg never spoke to anybody. This is your brain. This is your brain on drugs.
I think the egg was not effective. Well, the other thing that I see happening, and this is just a real challenge, is that because parents are now so much more aware of fentanyl, that they will say, okay, well, at least it's not fentanyl, right? And maybe that's true in the short term, right? Maybe that's harm reduction. However, in the long term, not harm reduction. So it's really, it's something I wrestle with because, I almost lost my son to fentanyl. And so, yes, I want people to be aware of that. And I am incessantly talking about it. But are we losing the messaging around the dangers of THC because of what's happening with fentanyl?
Well, and what people need to be concerned about is if you're worried about fentanyl, you need to be worried about marijuana, because there's more and more research showing that those two receptors are integrally linked in the brain, and marijuana increases the risk of using opiates. So there's a really nice study looking at the number one risk factor for developing opiate use disorder is using marijuana before the age of 18. And there have been many studies showing this correlation. And then there was recently a study looking at people who had opiate use disorder on MAT. And if those used cannabis, they had a significantly increased risk of suicide over those not using cannabis with opiate use disorder. And then they've also shown studies that naltrexone actually can augment the effect of the cannabis.
Oh gosh.
And so they're working together very integrally. And what we've seen in Colorado for sure is cannabis has not stopped the opiate epidemic at all. We have had a massive increase in fentanyl overdoses, and we've had more marijuana available than any other state. And so
Correct. Yeah.
I think it's actually making it worse. And there was a brand new study looking at the states that have legalized marijuana and the opiate overdose deaths, and showing that the opiate overdose deaths had been much higher significantly in states that have legalized versus those that have not legalized cannabis.
That is interesting because here in Washington, we had billboards all over the place a couple years ago that said in states that have legalized marijuana, opiate overdoses have gone down. And I thought, what's
Yeah.
possible?
No,
And I noticed that those are not up anymore.
No, the industry will still keep bringing up that one study. And that was a one study that was done early. This is before all the concentrates and stuff really hit the mark. And it was done with a Medicare population. So it was done with older people who, were on opiates, and their doctor would tell them they had to get off. And so another group came in and replicated that study after multiple other states had legalized, and they found the exact opposite. It was a total reversal. So even though initially they said there was like a 23% less opiate overdose deaths in the states that have legalized medical, and then it reversed to then it was like 23% increased overdose deaths.
Yeah.
And so, yes, they stopped those. And in fact, I think one of the authors in this paper is from Washington. So, yeah, I mean, people are really starting to recognize this.
The kind of the link between marijuana and opiate use is it because of tolerance that if somebody starts with marijuana, they reach a certain level of tolerance where they're not getting the same effect and then they move to opiates, or is it something different?
No, I think it actually stimulates the use of opiates.
Oh, okay.
They did this study in women. So this is in humans with aborted fetuses. So these were elective abortions, and they were looking at the brains of the offspring. And they found that there was a totally, the opiate receptors were totally affected in the brain by cannabis during pregnancy. Now, you don't know what happened to those kids, obviously, but if you look at animal research where they have pregnant rats and they give them cannabis while they're pregnant, and then they look at the offspring are much more likely to push the lever for heroin or opiates than if they were not exposed to cannabis. So it's like the cannabis exposure affects the opiate receptors in some way.
Okay. Very interesting. Well, you are a wealth of knowledge. I feel like I could talk for days about this. Hopefully by now parents have said, like, okay, this is a problem. This is not just marijuana. And it's got to be a lot for you just knowing all of this and talking with so many people. So I'd love to find out, what do you love most about what you do?
Well, I've always loved working in this field because I love it when people get it and they actually turn their life around. And that's what I love about working in the field of addiction is we don't fix people. We teach people how to fix themselves. And
Right.
when people actually get it and start doing, what they need to do to take care of themselves, it's just amazing.
Yeah. Well, and that's also, I think, a hopeful thing for parents to recognize that this isn't forever. Kids can come back from this and turn around, and so that's always the good news
Yes,
is,
I'm
and you see it.
my message is recovery is completely possible, but it takes a lot of work.
Yes. Yes. And especially it takes work on the parents' part too, if you have a young person, just to understand all of this and figure out where to find the resources. So I'm thrilled to have all the resources that you mentioned today, and I'll put all of those in the show notes for people. So thank you for joining us. This has been amazing, and I just appreciate your time so much.
Well, thank you. I appreciate it.